The top stories tonight in Y News. President Rodrigo Duterte has been inoculated against COVID-19 using Sinopharm vaccine.
Solons to continue distribution of ivermectin to the public despite health experts' warnings.
The Philippine government mulls over banning travel to countries with high passenger traffic from India. The Philippines fires 2 new protests against China over its belligerent actions against the Philippine Coast Guard.
Scientists warn on use of public restrooms with poor ventilation during the pandemic.
And largest plane by wingspan takes second test flight successfully. Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Monday, May 3, 2021. I am Hardin Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and live via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The Food and Drug Administration and the Professional Regulation Commission have started looking into the mass distribution of anti-parasitic drug ivermectin following reports of invalid prescriptions. Aiko Miguel will tell us why live. Yes, Aiko?
Yes, Harleen, the Department of Health has already sent a formal letter to the Professional Regulation Commission, or PRC, for the investigation about the alleged invalid prescriptions issued by doctors. Last week, the DOH said that members of the Concerned Doctors and Citizens PH allegedly wrote prescriptions on a sheet of paper instead of a prescription pad. A valid prescription should contain the date of expiration, the patient's name, age, and sex. Pertinent details about the prescribing physician should also be included, such as name, office address, professional regulation number, and professional tax receipt number if applicable. Here is Undersecretary Maria Rosario Vergere, the spokesperson of the Department of Health.
Already have acknowledged this. Ito po ay nagbigay tayo ng mga anecdotes at saka alleged na mga nireport sa atin about the invalid prescription. No? And of course, we like to also know from them the practice of profession, no, nitong mga sumali dito na mga healthcare workers natin who are licensed by PRC. The Secretary of Health also have given that instruction to the FDA last Friday to do that parallel investigation as well.
Harleen, in an interview, Anak Kalusugan Representative Mike Defensor said the DOH should not run after the doctors who distributed free ivermectin. But according to the DOH, they will not let this slide, especially that the public safety is at risk.
We will act accordingly, according to the existing laws that we have in the country, according to the identified violations, according to the accountable person. So yun po gagawin namin. We are on to that position and direction na i-uphold namin kung ano sinasabi sa batas at gagawin po namin yan.
The Department of Health stands firm that as medical professionals, they will only recommend drugs that are potent and effective to cure a disease. But currently, even the World Health Organization does not recommend ivermectin as cure against COVID-19. People should also use it without a doctor's guidance and explanation about the effects it can cause to an individual. And that is the latest live. Back to you, Hart.
Thank you, Aiko Miguel, reporting live. Anak Kalusugan Party List Representative Mike Defensor says the distribution of ivermectin in Quezon City will continue. This despite the investigation to be conducted by the Health Department and the Food and Drug Administration and the warnings from medical groups about the distribution of the drug as treatment for COVID-19. In an interview with Politicos Politiscoop, defensor said they will target senior citizens, persons with comorbidities, and essential workers. He adds he is ready to be held accountable and to give support to those who will experience adverse side effects from taking the drug. Last week, Defensor, along with Deputy Speaker Rodante Marcoleta and 4 doctors, gave free human-grade ivermectin tablets to 35 residents in Old Balara, Quezon City.
Huliin nila kami, ikulong nila kami, itutuloy ko, ipamimigay ko to sa tao. Libre naman to. Safe naman to. Wala naman akong pinipilit. Sana rin naman yung ibang officials natin openly gumalaw na rin talaga.
Defensor also maintains that what they did was legal. The lawmaker believes there was business involved behind the blocking of the use of the drug for COVID-19, allegedly from manufacturers of COVID-19 treatments and vaccine.
Alam mo, yung mga gamot kunyari ng Remdesivir, pag pumasok ka ng ospital, ikakarga kagad sa iyo yan eh. Marami nagre-reklamo eh. Is it business? Yes. May negosyo bang involved? Yes. May mga interest bang involved? Yes. Ngayon, ito bang negosyo at politika may connection? Yan ang isang misteryo na kailangan natin masagot lahat.
Despite this, Defensor is optimistic that COVID-19 cases in Old Balara will go down following the distribution of ivermectin. He adds he will help the medical doctors who issued alleged invalid prescriptions during the ivermectin pantry. A group of doctors strongly oppose the mass distribution of the anti-parasitic drug ivermectin to treat COVID-19. According to the group, they are doing more harm than good. Janice Inhenta will tell us why.
The Philippine College of Physicians stressed the importance of proper guidance from doctors and health experts in using the anti-parasitic drug ivermectin against COVID-19. The group pointed out that studies are still ongoing and there is no scientific proof yet to prove that ivermectin can treat COVID-19.
Kung meron man po itong activity o sinasabing effect, no, epekto doon sa virus like ng COVID-19, no, ito ay pinag-aaralan pa hanggang ngayon. No? Kaya hindi naman sa sinasabi namin na wala namang epekto, kaya lang gusto sana namin makita kung anong totoong epekto nito. No? Pangalawa, siyempre mas maganda na siguraduhin na ligtas ito. No? Kasi yun ang nakakabahala, lalo-lalo na kung anong nangyayari kung pinamimigay na ito, no? Basta-basta.
In the Philippines, ivermectin cannot be purchased in pharmacies as it is not registered as medicine for humans. The human grade or the human version of the medicine is currently under clinical trial. Ivermectin cannot be purchased even if a doctor prescribes it. Only hospitals that have been granted a compassionate special permit can import ivermectin for use on their patients and not for sale in pharmacies. In the case that happened in Quezon City last week, Representative Michael Defensor and Deputy Speaker Rodante Marcoleta distributed a compounded ivermectin. This is a mix of ivermectin to a registered pharmaceutical drug. The prescription given to patients by doctors who are involved in the distribution of ivermectin is to guide the recipients on when the medicine should be taken. But this prescription cannot be used to buy ivermectin at a pharmacy. According to the FDA, under the law, a licensed pharmacist should be the one releasing the medicines to a patient and not the doctor.
Kahit po meron doktor na nagdi-dispense during activities like medical mission, halimbawa, ang kamang gamot po have to be dispensed properly by a pharmacist dahil may batas po tayo.
Misuse of ivermectin could lead to nausea, vomiting, diarrhea, stomach pain, facial or lymph swelling. You may also experience neurological adverse events such as seizures, sudden drop of blood pressure potentially requiring hospitalization, and liver injuries such as hepatitis.
Sabihin man natin may doktor na nag-prescribe, pero alalahanin natin na may mga indications ito kung kailan bigay at saka kung maalala natin kung binigyan man ito ng permiso para sa compassionate use. Hindi naman ibig sabihin na basta-basta na lang ito magagamit, no? Lalo-lalo na kung nasa labas ng ospital.
Experts advises those who have been given and already use ivermectin, in case you experience any side effects, do not hesitate to report to the FDA Action Center at Pharmacovigilance at fda.gov.ph and consult a doctor immediately. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
In other news, the Philippines is studying whether or not to expand the travel ban to other countries with high passenger traffic from India. Meanwhile, the government may consider implementing less strict community quarantine over NCR Plus after May 14. Rosalie Cos will tell us why.
The government is not dismissing the possibility of worst-case scenario of the pandemic in the Philippines, in which the country could face a COVID-19 surge similar to that of India. Presidential spokesperson Harry Roque said the government considers more precautions, including expanding travel restrictions to other countries with high passenger traffic from India, specifically in the Middle East.
Pero ang warning nga po ng WHO, kinakailangan isama rin sa travel ban yung mga lugar kung saan mataas ang traffic involving passengers from India. Kasama po dyan yung Middle East. So yan po ang problema ngayon dahil hindi naman natin po pwedeng i-ban ang mga bansa, ang mga biyahero galing sa Middle East, lalong-lalo na dahil ang dami nating OFWs doon. No? So, pero pinag-aaralan po ngayon yan.
Currently, Indian passengers are not allowed to enter the Philippines until May 14. To also prevent COVID-19 surge, the government is intensifying its strategies against the pandemic and has been improving the health infrastructure. Last month, the government has been able to provide additional intensive care units or ICU beds capacity in the National Capital Region with 367 beds. Now, NCR has 1,148 ICU beds, according to Treatment SAR and Health Undersecretary Leopoldo Vega, and the government will keep on increasing it. If NCR will continue to decrease its healthcare utilization rate and sustain daily new COVID-19 cases, community quarantine over the NCR Plus may be loosened to general community quarantine.
The first is the suppression of the virus. I think the IATF is very well ahead in terms of making sure that the virus will not spread, will not replicate to an extent that we will be having a hard time in terms of our capacity.
Basta po, ma-maintain natin yung ating R0 at mapababa pa rin natin yung ating mga attack rate at magpatuloy po itong additional healthcare capacity natin, yan po naman, sang-ayon sa formula, may warrant GCQ, but that's a decision to be made by the IATF as a collegial body.
Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The repatriation of Filipinos in India will commence once necessary clearances are secured and the travel ban has been lifted. In a palace briefing, Philippine Ambassador to India Ramon Bagatsing said it is currently logistically difficult for them to send Filipinos home due to existing bans from India. The envoy said there are about 50 Filipinos in India who asked for government repatriation assistance. Bagatsing noted they are constantly communicating with Filipino communities to provide the support they need.
The Department of Health reported 7,255 new cases of COVID-19 today. This brought the total number of COVID-19 cases in the country to 1,062,225. The total recoveries also increased to 975,234, with the addition of 9,214 new recovered patients. The total number of deaths also rose to 17,525, with 94 new deaths. The case bulletin of the DOH also showed 69,466 active cases, of which 94.7% were mild, 1.8% were asymptomatic, 1.4% were severe, and 1.1% were critical. The health department said 15 labs were not able to submit their data to the COVID-19 document repository system. A rare neurological condition has been related to COVID-19 after 43 people across 21 countries were discovered to have such a complication. Nina Bascon reports.
In a recent study, researchers discovered the link between coronavirus and a rare neurological condition known as acute transverse myelitis or ATM. This condition is an inflammation of the spinal cord which causes pain, paralysis, and loss of sensory and motor response. It is also known to be involved in the immune process of the body. According to the study, it started with a report of a patient from Panama with COVID-19 and ATM complication. A comprehensive analysis was then conducted by the researchers from March 2020 to January 2021 to the 43 people with the same condition from different countries with patients aged between 21 to 73. According to the team, the data demand further investigation because ATM is a rare disease with an estimate of 1.34 to 4.6 cases per million people in a year. However, during the pandemic, the occurrence among COVID patients only is 0.5 cases per million. In the published article, it is concluded that ATM is a common neurological complication associated with coronavirus. Meanwhile, it was noted that the 3 cases of ATM discovered in AstraZeneca vaccine trials may be due to the same immune mechanism. However, further investigations will be required. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Department of Foreign Affairs fires 2 new diplomatic protests against China over the lingering presence of Chinese militia vessels in the Philippines' exclusive economic zone. Meanwhile, the Department of National Defense Secretary Delfin Lorenzana insists that the government will not withdraw its vessels in the West Philippine Sea. Nel Maribohok will tell us why.
Department of Foreign Affairs Secretary Teodoro Locsin Jr. expressed his disappointment on the continuous presence of Chinese vessels in Philippine waters. In his Twitter post, the Secretary demanded in an expletive-laced message that China's vessels should get off our territory. The DFA Secretary's statement follows after the Philippines filed today 2 new diplomatic protests against China. The DFA has protested the shadowing, blocking, dangerous maneuver, and radio challenge by the Chinese Coast Guard to Philippine Coast Guard vessels conducting maritime patrols in the vicinity of Bajo de Masinloc on April 24 to 25. Also, the Philippine government protested the increasing presence of Chinese vessels in West Philippine Sea, particularly in Pagasa Islands, Samora Reef, Panata and Kota Islands, Ayungin Shoal, Quirino Atoll, and Bajo de Masinloc from January 1 to March 18. Department of National Defense Secretary Delfin Lorenzana insists that the government will not withdraw its vessels in the West Philippine Sea. This is despite the opposition of the spokesperson of Chinese Ministry of Foreign Affairs on the maritime patrol of the Philippine vessels.
Thus, the conduct of maritime patrols in the West Philippine Sea and Kalayaan Islands by the Philippine Coast Guard and the Bureau of Fisheries and Aquatic Resources will continue. The government will not waver in this position. Walang alisan.
Meanwhile, Malacanang has appealed to former DFA Secretary Albert Del Rosario and retired Supreme Court Senior Associate Justice Antonio Carpio to just leave the issue of the West Philippine Sea to President Rodrigo Duterte.
Itigil na nila ang kanilang panlilinlang sa taong bayan sa kanilang mga illegal, impractical at irresponsableng pananalita. Hindi sila nakakatulong. Hayaan na nila si Presidente na may foresight, information.
Presidential spokesperson Harry Roque was responding to the rebukes of Carpio and Del Rosario on the President's latest remarks on the maritime dispute. Nel Maribohok, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, President Duterte has already chosen the new chief of the Philippine National Police, or PNP. Outgoing PNP Chief Dipoldo Sinas expressed his gratitude to all the cops who supported his initiatives to improve the image of the National Police. Leah Ilagan has the story.
Presidential spokesperson Harry Roque revealed that President Rodrigo Duterte has already chosen the new chief of the Philippine National Police. However, the palace official refused to reveal the name of President Duterte's pick.
I know he has made a decision, but I'm not at liberty to announce anything unless I have the appointment paper.
President Duterte designated Sinas as Chief PNP in November last year to replace retired General Camilo Cascolan. Sinas is set to bow out of police service on May 8. Meanwhile, in his last press conference as Chief of the Philippine National Police, Police General Debold Sinas lauded the PNP officers and personnel for their good service during his term.
Ang lahat ng accomplishment na ipinagmamalaki natin ngayong araw na ito ay nagmula po lahat sa inyo. Every accomplishment of the PNP lies the story of the 220 strong policemen and women of the Philippine National Police who heeded the call to fight illegal drugs, crime, corruption, and terrorism.
Despite serving only 6 months, Sinas expressed that he did well in his job, especially with the current pandemic crisis.
We have done our best that answers the challenges of the day. And very happy that in spite of the big challenges, particularly the COVID-19 pandemic, we're able to give the basic police services to our community.
Sinas hopes the next Chief PNP will continue the Chubby Anonymous program to keep the policemen fit and healthy. Being one of the participants of his initiative, the outgoing PNP chief bears that he already lost 32 kilos.
Yung Chubby Anonymous, that serves an example. Kung mapansin nyo, ang tinarget ko lang talaga ay yung obesity. Obesity lang talaga. Hindi na ako nag-target yung maliliit na mag-exercise because kaya na po nila sarili nyo yun. At this is volunteer. Wala pong pwersahan to.
Sinas also believes that by doing good, the PNP will be able to restore the people's trust.
Masigasig kayong magpapatuloy sa inyong gawain at humanap ng paraan upang matugunan ang pangangailangan ng mamayan kahit pa ang kapalit nito ay inyong buhay at kalusugan.
The Chief PNP also reminded the police personnel to implement the law equally and to fight against those who want to overthrow the government. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
A group of health workers is appealing to President Rodrigo Duterte to back them up to clear their names after being linked to the Communist Party of the Philippines New People's Army in an article written by Presidential Communications Operations Office or PCOO Undersecretary Lorraine Badoy. Dante Amento tells us why.
Alliance of Health Workers or AHW condemned and denied the allegedly red tagging claim made by PCOO Undersecretary and NTF-ELCAC spokesperson Lorraine Badoy in her article last April 7. Badoy, who is also the spokesperson of the National Task Force to End Local Communist Armed Conflict, claimed that the AHW is being used by the communist group to be able to penetrate health facilities in the country, including the Philippine General Hospital. According to the group's president Robert Mendoza, even he himself is being linked by Badoy to the communist rebels. Mendoza said they are appealing to President Rodrigo Duterte to clear their names because they fear for their safety.
Kasi kami na nga lang natitira ngayon na humaharap sa pandemyang ito at bakit mo pa i-red tag ang mga health workers? In fact, mga government employees kami lahat.
The same goes for Filipino Nurses United, which is being linked to the NPA by certain social media posts. The group said instead of insisting on baseless accusations, what the government should address is the distribution of performance-based bonuses of health workers from 2018 to 2020, which they haven't received until now. The group also calls on the government to expedite and complete the processing of various benefits such as the special risk allowance and hazard pay under Bayanihan 2.
Sana yung active hazard duty pay ay gawing 5,000 pesos, no? At yung special risk allowance ay gawing 15,000 pesos para sa lahat ng health workers kada month, no? And hindi lang doon sa COVID ward at nasa direct patient.
The DOH clarifies that it already downloaded fund for the health workers benefits for the period of September to December 2020.
nabayaran natin at naibigay natin sa mga facilities, yung mga dapat ibayad sa healthcare workers hanggang sa dulo ng December of 2020. Isa yan sa kanilang mga complaints dahil may mga healthcare workers na hanggang sa ngayon hindi pa nakukumpleto yung kanilang mga benepisyo nung last year pa, nung December 2020.
The Health Department assures that aside from the protection of health workers, it is doing its best to provide the best compensation for health workers. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
A labor group is pushing for the amendment of the current minimum wage setting in the country. Ray Pelayo will tell us why.
The Associated Labor Union Trade Union Congress of the Philippines, or ALO-TUCP, describes the Republic Act 6727 or the Wage Rationalization Act, which was enacted in 1989, obsolete. ALO-TUCP spokesperson Alan Tanhusay said that the minimum wage now is insufficient to sustain the need of a worker. Region 1 has the lowest minimum wage, ranging from 282 to 350 pesos, while NCR has the highest of up to 537 pesos. The labor group noted that the purchasing power of the minimum wage is less than the cost of food, bills, and other necessities.
Ang kalalabasan nito yung tinatawag na real wage, yung purchasing power. So, dahil sa mga percentage na ito, ibabawas mo doon sa nominal wage ng 537, ang kalalabasan, ang buying power ng minimum wage ngayon sa Metro Manila ay 433 pesos.
The National Wage Productivity Commission said that aside from the needs of workers and their families, they also consider other factors in determining minimum wage in regions.
Pag tinignan po natin yung needs of workers and their families, pwede pong sabihin na hindi na talaga siya sapat. But yun nga po, nakalagay sa batas na kailangan mo rin siyang i-balance kasi doon sa employer's capacity to pay at saka yun doon sa requirements of economic development.
The labor group said that the minimum wage should be 1,200 to sustain the need of a family of 5 to live a comfortable life, but pointing out that employers should not shoulder it all, but instead the government should fill the other needs like giving subsidy.
Kailangan pag-aralan po yan ng gobyerno kasi wala nga po yan sa RA 6727.
Bangladesh, Pakistan, and Myanmar has least minimum wage of around 150 pesos. Mongolia, Cambodia, Vietnam, Thailand, and China has almost the same minimum wage as the Philippines. But other countries like Hong Kong, Taiwan, South Korea, Japan, New Zealand, and Australia has 3 to 10 times more. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippine Statistics Authority, or PSA, is regulating the number of registrants in the National Identification System, or PhilSys, online registration. Asher Cadapan Jr. explains why.
A technical problem is still being addressed in the online registration system for the initial step in the application for a national identification. National Economic Development Authority explained that the issue was due to the high number of registrants who simultaneously tried to register on its launching day on Friday. NEDA Secretary Carl Kendrick Chua said in an interview that the system has a capacity that may only be scaled up to 35,000 users per minute. The Philippine Statistics Authority, on the other hand, was able to record as much as 90,000 registrants.
Siguro 46 yung una, pero tumaas pa siya actually. Umabot siya ng 90, alam namin. Doon, kaya ngayon yung mga hindi pa namin nakukuha ng mga final figures kung ilan talaga yung pumasok.
The PSA assures the public that the issue is being resolved while the user's capacity of the online platform is also being increased. Despite the issue, the national ID registration is still available online but with limited capacity.
Ina-update na buhay pa yung system, buhay siya. In fact, may mga nakaregister kami ng April 30, yung nakapasok ng 30, May 1, May 2, but it's not the kind of capacity na gusto namin paandarin. We want to get people na when they go there, makakapasok sila.
Asher Cadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte receives his first dose of Chinese-made Sinopharm vaccine tonight. The vaccination of the chief executive in Malacanang was broadcasted live on the Facebook page of his former top aide and now Senator Christopher Bongo. It was Health Secretary Francisco Duque III who administered the vaccine shot, and presidential spokesperson Harry Roque confirmed that the first dose was covered by the compassionate use permit issued to the Presidential Security Group Hospital by the Food and Drug Administration. Senator Go said the president's doctor gave clearance for the president's inoculation. The application for emergency use authorization of Sinopharm has been submitted to FDA and still waiting for approval. But FDA issued a compassionate use permit for the 10 doses of China's Sinopharm vaccine.
The Department of Health will start the rollout of the Sputnik V vaccines in 5 cities in Metro Manila. Aiko Miguel will tell us why.
Based on the indication of Gamaleya Research Institute's COVID-19 vaccine Sputnik V, it can be administered to all age groups. It appears that people from E1 to E3 sectors are qualified to receive the Russian-made vaccine. These are the medical frontliners, senior citizens, and those with comorbidity.
So ang naitag po, kapag nagbigay ng indikasyon ng FDA through the Emergency Use Authority, yan po yung ina-adapt natin. Hindi tayo magbabago dyan, not unless there are specific na kailangan pag-aralan na pwede po natin na masabi based on evidence na existing.
The vaccine has a 91.6% efficacy, which will first be inoculated on the 5 cities in Metro Manila. 3,000 doses each will be given to Taguig City, Manila, Muntinlupa, Makati, and Parañaque. The Sputnik V vaccination in Makati, Taguig, and Parañaque City will be conducted in vaccination facilities, while 2 separate hospitals each will serve as vaccination sites in Manila and Muntinlupa. The vaccine cluster are now preparing for the rational storage and distribution process for the additional doses of Sputnik V come the arrival of additional 480,000 doses.
Meron naman po tayong mga storage facilities na may ganitong kakayanan dun sa mga major natin na mga regions na urbanized, katulad ng Davao, ng Cebu, katulad I think in Region 4A, Region 3, and Region 6. Meron po tayong mga ganyan. Meron po tayong kausap na ng mga logistical firms kung saan they have that capacity to transport this kind of vaccines. We would like that we can see how we are going to manage it properly, to store it properly, and to distribute properly. Titignan natin yung experience natin dyan, at kung meron tayong kailangang i-improve po natin.
As of May 1, there are 1.93 million Filipinos belonging to the priority sector who have been inoculated with COVID-19 vaccine. More than 284,000 of them have completed their second dose. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Malacanang is hoping that Hong Kong officials will not single out overseas Filipino workers or OFWs in its compulsory COVID-19 vaccination. The palace made the statement after Hong Kong planned to make COVID-19 vaccines compulsory for the 370,000 domestic workers applying for a renewal of their working visas. The Hong Kong government also directed all domestic workers to get tested over the coming days. Most of the domestic workers in Hong Kong are from the Philippines and Indonesia.
So sana po wag i-single out ang ating mga Filipino OFWs, bagamat we recognize yung sovereign prerogative na i-require ang bakuna. We have an early 1905 case na sinustain po ng Korte Suprema ng Pilipinas ang mandatory vaccination against smallpox as forming part and parcel of police power. Pero pati po ang exercise of police power, it must be done in a manner na lahat po ng tao sasakupin. Wag naman pong magkakaroon ng singling out.
Meanwhile, a recent study by a team of scientists from a university in Florida, USA, warned about the use of public restrooms with poor ventilation and do not use the toilet lids or covers. Nina Armilio tells us why.
Scientists from Florida Atlantic University's College of Engineering and Computer Science puts the physics of fluids to the test once again. The aim is to investigate droplets produced when flushing a toilet and a urinal in a public restroom under normal ventilation conditions. Public restrooms are especially cause for concern for transmitting COVID-19 because they are relatively confined, usually crowded, and not at all times equipped with adequate ventilation. To measure the droplets, they used a particle counter placed at various heights of the toilet and urinal to capture the size and number of droplets generated upon flushing. Siddhartha Verma, PhD, co-author and assistant professor of FAW's Department of Ocean and Mechanical Engineering, asserts that after about 3 hours of tests involving more than 100 flushes, they found a substantial increase in the measured aerosol levels in the public toilet used in the study, with a total number of droplets generated in each flushing test ranging up to the tens of thousands. He added that both the toilet and urinal gathered large quantities of droplets smaller than 3 micrometers in size, posing a significant transmission risk if they contain infectious microorganisms. Due to their small size, these droplets can remain suspended for a long time. Results of the study demonstrate additional evidence how public restrooms could serve as breeding ground for airborne disease transmission. The study suggests that incorporation of adequate ventilation in the design and operation of public spaces would help prevent aerosol accumulation in high occupancy areas such as public restrooms. However, further study is ongoing to better understand the spread of the virus and which settings are most risky and why, according to the World Health Organization. The WHO continues to advise people to keep away from the 3 C's, or crowded places, close contact settings, especially where people have conversations very near each other, and confined and enclosed spaces with poor ventilation in order to avoid contracting COVID-19. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
Good evening for the news abroad. India sets another new grim milestone of new death cases as the COVID-19 crisis engulfs overstretched hospitals. Marvi Delphine tells us the details live. Yes, Marvi?
LC, India is still struggling with the coronavirus as death tolls persist at high rates. Within the last day, 3,689 deaths have been recorded and 400,000 additional cases have been declared by the Indian Health Ministry. The shortages of hospital care availability and limited supplies of oxygen have made it difficult to aid the large number of infected patients. Concerns regarding the management of President Narendra Modi over the coronavirus are continuously being questioned as the mishandling of the virus has resulted in this crisis. To this date, India has become second to the US with cases tallying up to more than 19 million, with approximately 218,000 deaths, of which are speculated to be more. Many factors to this staggering ordeal have been considered: low testing, at-home deaths, additionally in rural areas where numbers have not been counted. The Oxford AstraZeneca Covishield Bharat Biotech Covaxin vaccine, as well as the Sputnik vaccines, have been permitted for adults in the age bracket of 18 to 44 years old. However, the initiation was unsuccessful as there was a lack of vaccine supply to begin with. Only 84,599 adults were given their first dose, reported on Sunday by the Health Ministry. Positively, 40 nations have sent their aid to India. Dr. Harsh Vardhan, the Health Minister of India, extends his gratitude to the USA for their shipments of medical supplies, oxygen tanks, masks, and COVID-19 tests. The US has delivered raw materials to make AstraZeneca vaccines in India locally. Back to you, Elsie.
Thank you, Marvi Delphine, for that live report. The United States will launch talks and appeal to the World Trade Organization, or WTO, for a more widely distributed COVID-19 vaccines. Mavian Dog will tell us why live.
LC, the U.S. joins an effort to waive patent rules for COVID-19 vaccines and find ways to overcome intellectual property issues to allow poorer countries to inoculate their populations by producing their own generic versions of the shots. According to White House Chief of Staff Ron Klain, the U.S. Trade Representative Catherine Tai will be starting trade talks with the WTO next week with an aim to get the COVID-19 vaccines more widely distributed, licensed, and shared. This advice comes as the U.S. faced criticisms for hoarding and focusing on vaccinating Americans, which prompted calls across the world for the U.S. to provide vaccine supplies and help to poorer countries. Meanwhile, Ron Klain also added that the U.S. has sent enough raw materials that India needs to make 20 million vaccine doses immediately, as they battle with a deadly new surge of the virus infections and deaths. The White House administration will have more to say on their talks with the World Trade Organization in the coming days. Back to you, Elsie.
Thank you, Mavian Dog. Stratolaunch presented its largest aircraft for a test under a new ownership for the first time. Annie Mancilia reports why.
Stratolaunch, an aerospace firm, took its tremendous carrier airplane named Rock for its second test of trial. This flight was managed under new ownership, coming 2 years after the twin fuselage craft's initial flight test. On Thursday last week, Rock's wheels had reached a peak altitude of 2.6 miles over the Mojave Desert in California. The massive aircraft used up 6 engines that helped last for 3 hours and 15 minutes on the air before landing down on the gigantic runway at the Mojave Air and Spaceport. It appeared to be extremely successful, that resulted in the plane lasting a longer flight than its first flight back in 2019. However, it flew slightly lower than its previous flight. The test flight was intended to see how the plane handles cabin pressurization and to test safety features and some new hardware upgrades. Stratolaunch stated that Rock will aim to soar higher and faster on the following tests over the next year until it can prove itself capable of hitting the right flight conditions required to launch Talon A and other hypersonic vehicles. Annie Mancilia, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
And those are the reasons behind the news, May 3, 2021. I am Marlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.